At the top, the virus has been part of our lives now for the majority of 2020, and tonight we have a look at how it has evolved and how it's affected the way that people have become infected with it. Our Chelsea Torres kicks off our team coverage tonight.
We've learned from one infectious disease doctor that the coronavirus has been around for decades, but this particular strain, what we know of as COVID-19, is so complex that health officials are continuously learning new things ever since the outbreak of the virus.
I lost my sense of smell and taste.
It was like every joint in my body hurt.
From the start of the COVID-19 pandemic, it was typical to see patients with respiratory issues. As months passed, health officials noticed other symptoms such as gastrointestinal issues.
Some people have trouble breathing, some people have loss of taste and smell, some people have mild symptoms.
Dr. Ram, local health authority, says 80 to 85% of people do not even show any symptoms at all. But that 15% that do show symptoms,
Certain age and also underlying uncontrolled diabetes and obesity. These are the factors influencing who gets sick and who doesn't.
Wanda Dukes, mayor of Refugio, said she fainted before being admitted to the hospital and said it was incomparable to any other sickness she had had.
It was nothing that I had never experienced before. It just affected my whole body.
Duke says even after the virus passed, she still felt affected.
One lady told me she developed a rash afterwards or something.
Dr. Nick Adame, president of the Council LULAC 1, said he thought he had had a sinus infection at first before testing positive for COVID-19.
It got pretty intense. I couldn't walk 10 feet and without having to sit down and catch my breath. It was really bad.
Infectious disease doctor at Driscoll Children's Hospital, Dr. Jaime Fergie, said health experts realized over time that COVID-19 affected blood vessels themselves.
It became what we call a multi-system disease, much more, way beyond just a respiratory infection.
Chelsea Torres, Chris 6 News.
Now, Dr. Fergie also says health experts are constantly learning more about the COVID-19 virus, and with flu season approaching, he says it's very important to get a flu shot because it could lower your risk of getting COVID-19.